As we sit here this morning, 1 in 104 adults are behind bars. 1 in 33 adults in the United States are under correctional supervision. Since 1980, the number of people going to jail in the United States has tripled, and their sentences have increased by 166%. And as you drill down deeper, as you pull away the onion and you peel it back, what you are going to find is much of this increase is due to untreated mental illness and substance use disorders. In fact, people with mental illnesses in the United States are 9 times more likely to be incarcerated than hospitalized. They are 18 times more likely to find a bed in the criminal justice system than at any state civil hospital. Annually, we have more than 2 million people with serious mental illnesses arrested, and on any given day, we have about 360,000 people with serious mental illnesses behind bars, and another 760,000 under correctional supervision. 40% of all people with mental illnesses, 40% of all people with mental illnesses at some point will come into contact with the criminal justice system. This is a shameful American tragedy, and it is one that must and can be reversed. Our counties are currently spending, and it's a good thing you're sitting down, $80 billion a year to warehouse people in jail. $80 billion a year. It has gotten so bad that our counties are now having to make decisions if they should build a new jail or a school, if they should build a new jail or a hospital, if they should build a new roadway or a jail. I'm going to start with a short video that was produced by my local CBS affiliate that does a wonderful job at showing the horror of this problem.
In these jail cells all suffer from mental illness. They're accused criminals, not guilty in the eyes of the law, but forced to live in conditions you cannot imagine.
Our chief investigative reporter, Michelle Gillen, has been given unprecedented television access to reveal what's going on. Michelle joins us now, and I was shocked, to say the least, when I saw this.
I think certainly it is time for the public to see what is going on. The pictures you are about to see are indeed haunting and most disturbing. Hundreds of men with mental illnesses, many crammed into tiny cells, some arrested for minor crimes that advocates say would have the average person out of jail in just hours. But incredibly, there is no place to send them. Tonight, our cameras take you inside a world rarely exposed, the forgotten floor.
And then they get thrown into a cell.
I can't breathe right now.
Prison insiders call this the forgotten floor, but it seems unimaginable that the horrendous, be it horrifying conditions of a jail spilling over with inmates suffering from mental illnesses could be erased from any sane man's mind. As frigid air is pumped into sealed cells, some beg for help for the barest of necessities, water. The faucets are dry.
The water's not working.
The water's not working. He's drinking sewer water. He's drinking toilet water out of the toilet.
We'll get you water. It doesn't work, the faucets. The faucets aren't working.
These stench-filled cells were designed for one person, outfitted with only a single steel shelf for a bed.
In this one, there's 3 inmates in a cell for one.
Yet 2, 3, sometimes even 5 men diagnosed with mental illnesses, in most cases arrested for low-level felony crimes, in some cases misdemeanors, are locked up for days, weeks, months. Tell me about you. Tell me, living in this, what do you want the public to know tonight?
I want the public to know that people in here, they're urinating on the floor, and we have to sleep on top of it. They're defecating on the floor, and you have to sleep on top of it. There's only one bunker that's made of steel.
And how many people are in your cell?
There is 4 in here right now.
They are only allowed out of their cell for 15 minutes 2 times a week.
30 minutes a week they're allowed out.
So other than a half an hour,
That's it.
this is it. They
Right.
are in this room.
Lights are on 24/7. The conditions you see just do not change.
I've been in Vietnam. I've been in Vietnam after 18 months in Vietnam. It's worse conditions in here. I wouldn't put a dog in here.
A chilling perspective from the jail's chief psychiatrist, Dr. Joseph Portier.
You would think that in 2006, we would treat people with chronic mental illness in a much better, more humane manner. But unfortunately, we're reverting back to how it was in the 16 and 1700s, which is terrible. It's morally incomprehensible.
A sentiment echoed by an outraged Miami-Dade County judge, Steve Leifman.
This is like a secret that people don't know about.
It's a bad secret, and it's a sad secret.
What most of you don't know is that the Miami-Dade jail now serves as the largest psychiatric facility in the state of Florida. 3 of 9 floors burgeoning with inmates suffering from mental illnesses and, according to Leifman, in desperate need of treatment. Not this type of confinement designed to punish people.
5 times as many people in our jail with mental illness than any psychiatric hospital in Florida. 5 times.
In this, right here.
Right here.
An elderly man emerges from the dirt and darkness.
There's one on the floor underneath the bunk and 1 or 2 standing around waiting for their turn to sleep.
And the crisis has unfolded across the state. In other Florida jails where they strive to comply with all the national standards for housing inmates, frustration over the virtual abandonment of mentally ill inmates left by the state to languish in jail cells for months runs deep. Colonel David Parrish.
Can you imagine the chaos that would result in the local criminal justice system if I stood at the booking door and said, sorry, we don't have any more room, we're not taking them from you, law enforcement?
Parrish from Hillsborough County says local authorities had no choice but to sue the state of Florida to force the Department of Children and Families to comply with their legal mandate to transfer mentally ill inmates to a treatment facility within 15 days.
Jails should not be the de facto mental health facility for a county, but that's what they are in the United States.
You had your birthday here. How old were you?
I was 21.
21. And you've been here 8 months. In Pinellas County, the weight of incarcerating and caring for mentally ill inmates had everyone paying a price, an unacceptable one, according to Major Kirk Brunner.
We are not a treatment facility, and these people that you saw in Delta 1, the one that plucked his eye out, they need to be in a treatment facility, which is the responsibility of the state, not our responsibility.
And therein lies the danger. William Weaver Sr. was caring for his 40-year-old son Bill at home, a son he says suffered from schizophrenia but functioned well for decades until his medicine was changed. Then one night, according to police records, he attacked his elderly father, who called police and urged them to arrest his son, hoping this would trigger treatment.
Because he was under the false idea that if he got arrested, he'd get treatment.
Bill ended up locked up in a cell on floor 9 of the Miami-Dade Pretrial Detention Center for several months. According to authorities, Bill jumped from this top bunk bed, cracking his skull and breaking his neck. He's now a quadriplegic who needs hospitalization to stay alive. We met up with his father, who had just left his hospital bed.
Do you think anything has come from what the incident of what your son went through?
Nothing. Nothing's changed. Do I think something could change? I don't know. I don't know. It's time. It's time. Something changed. But I don't know if it ever will.
It's a pretty sobering look at the state of our mental health system, not just in Miami, but sadly around the United States. Tragically, the young man you saw in the video recently passed away as a result of his injuries, and his father, we believe, passed away soon thereafter, probably from a broken heart. But things do change. Last year, we closed those horrible floors in our Dade County Jail and opened a much, much more appropriate facility. But the answer is not building a better jail to house people with mental illnesses. The answer is to build a systematic change in the community so people with mental illnesses don't need to end up in the criminal justice system to begin with. My journey into the mental health world actually began one morning when I was getting ready to get on the bench. I was approached by the assistant public defender and the assistant state attorney, and they said, "Judge, we have a case you're going to hear soon, and we'd like you to speak to a couple whose son is in jail, and it's really a fascinating, sad story. Could you please talk to this couple?" So I brought this lovely couple into my chambers. They were very, very sophisticated. They were very, very distraught. The mom was crying, the dad was shaking, and they literally started to beg me to get their son help. They told me that their son was brilliant. He had gone to Harvard. He had a late onset of schizophrenia, and he was now homeless and recycling through the criminal justice system, and they just didn't know what to do. I was pretty new at the time, and I think when you're a new judge, you think you have a lot more power and a lot more wisdom than you really do. And I was pretty naive, and I thought, well, there must be a mental health system, because I knew, ideal and logic, if someone got arrested and they had a heart attack, there was a system very clearly in place for them, and we knew what we needed to do. And I just assumed we must have the same thing. So I promised them that I would get their son help. As I started to go back into the courtroom, the mom stopped me and she said, "Judge, there's one more thing I need to tell you about my son." She said, "Not only is he brilliant, but respectfully, he probably knows more about the mental health system than you do." And I just looked at her. I didn't quite understand what she was saying. She said, "Well, you see, my son is the former head of psychiatry at Jackson Memorial Hospital, our largest public hospital in Florida." I was kind of taken back, and I went into the courtroom and I called his case. Now, you have to understand, at the time I was handling a jail division for people charged with misdemeanors, very low-level offenses. So there's three kinds of people in that division. There are those with attached